Hey there, I'm glad to see you again. Well, today I'm a drug under laxatives, specifically the chemical stimulants, and I would like to introduce my two different personalities to you, Senna and Castor Oil. As the drug-Senna, my generic name is Senna. My brand names are Black Draught, X-Lax Chocolated, Fletcher's Castoria, Nitalax, Senexone, Senolax, X-Prep, and the most common is Sinocot. Please remember that. And again, my chemical name is really complicated, so here it is.
Now, let's discuss about my drug classification. For therapeutic classification, I am a stimulant laxative, while in pharmacologic, I am an anthraquinone derivative. For my pregnancy category, I am pregnancy category C, which means I am not indicated for pregnant women because the evidence of teratogenicity was not able to reveal by the animal studies. Also, there are no controlled data in human pregnancy. I should be given to the pregnant women when the benefits outweighs the possible risk. Let's go now to my mechanism of action. I am sure that you are curious as to how I work in the body and what reactions are going to happen when you take me. So, I am a stimulant laxative. I induce defecation by stimulating propulsive peristaltic activity of the intestine through local irritation of the mucosa or through a more selective action on the intramural nerve plexus of intestinal smooth muscle, thus increasing motility. I also increase concentrations of cyclic 3,5-adenosine monophosphate in colonic mucosal cells and may alter the permeability of these cells and mediate active ion secretion, producing net fluid accumulation and laxative action, thereby increasing the moisture content of the stool. Lastly, I mainly promote evacuation of the colon.
Now let's talk about my pharmacokinetics. I am minimally absorbed following oral administration. My distribution is not fully characterized. I may be distributed into bile, saliva, and colonic mucosa. I am metabolized in the liver, and my metabolites are eliminated in feces via biliary excretion and/or in urine. If you administer me orally, my onset is 6 to 10 hours, my peak is variable, and my duration is 12 hours. If you administer me by rectum, my onset is 1/2 to 2 hours, my peak is unknown, and my duration is unknown as well. Now let's talk about my indications. I'm a prescription medication used for the treatment of acute constipation, but please take note that I am the mildest among all the stimulant laxatives. I give less pronounced laxative effect compared to bisacodyl and castor oil. And also, I am used for colonic evacuation. I am used orally to empty the bowel prior to surgery or radiologic, proctoscopic, or endoscopic procedures.
I also have contraindications and cautions. That's why the nurse needs to be responsible enough to assess the status of the patient. I am contraindicated to people who are allergic to me to avoid hypersensitivity reaction. I am also contraindicated in patients with ulcerative bowel lesions, nausea, vomiting, abdominal pain, or other symptoms of appendicitis or acute surgical abdomen, fecal impaction, or intestinal obstruction or perforation. Are you wondering what are the side and adverse effects that you can experience when you take me? Yes, you heard me right. I have side and adverse effects you will experience and it can affect your health status. Let's tackle it in every system. In digestive system, you will have nausea, vomiting, diarrhea, loss of normal bowel function with excessive use, abdominal cramps especially in severe constipation, malabsorption of nutrients, cathartic colon with chronic misuse, possible constipation after catharsis, yellow or yellow-green cast to feces, diarrhea in breastfeeding infants of mothers receiving me, darkened pigmentation of rectal mucosa with long-term use, laxative dependence with excessive use. In urinary system, you will have red-pink discoloration in alkaline urine and yellow-brown color to acidic urine. In metabolic, you will have protein-losing enteropathy and electrolyte imbalance such as hypokalemia.
Now let me introduce to you my second personality. In other words, my second drug assignment. My generic name is Castor Oil. My brand names are Imosoil, Neoloid, and Purge, and my chemical name is again, it's complicated and it's right here.
Let's go now to my drug classification. For therapeutic classification, I am a stimulant laxative, while in pharmacologic, I am a glyceride or resinous communist derivative. Let's discuss about my pregnancy category. What is my pregnancy category? Am I safe to the pregnant woman or not? The answer is no, because I belong to the pregnancy category X, and it is not recommended for pregnant women to use me because it has been shown that women who take castor oil during their pregnancy may have babies with problems. The risk of harm to the baby outweighs the benefits that the mother can get by the drug. How does they work in the body? I know you are all asking this while watching this video. Well, that question will lead us to the pharmacodynamics of the drug or the mechanism of action. So I have a laxative action. I act primarily in the small intestine where I am metabolized to ricinoleic acid by the intestinal phase. Ricinoleic acid reduces net absorption of fluid and electrolytes, thereby promoting fluid accumulation and stimulates intestinal peristalsis and bowel motility.
Now, let's talk about my pharmacokinetics. My absorption is unknown. I am distributed locally, primarily in the small intestine, and just like other fatty acids, I am metabolized by intestinal enzymes into my active form, which is the ricinoleic acid. And lastly, I am excreted in the feces. If you administer me orally, my onset is 2 to 6 hours, my peak is variable, and my duration is variable. Now let's talk about my indications. Just like Senna, I am also used for the treatments of acute constipation, but I am more effective compared to Senna. I am also used for colonic evacuation. Just like Senna, I am used orally to empty the bowel prior to surgery or radiologic, proctoscopic, or endoscopic procedures or examinations.
Let's proceed to my contraindications and cautions. I am contraindicated in pregnant women, menstruating women, patients with ulcerative bowel lesions, and patients with abdominal pain, nausea, vomiting, or other symptoms of appendicitis or acute surgical abdomen, and to those who are allergic to castor oil. I am also contraindicated in patients with anal or rectal fissures, fecal impaction, or intestinal obstruction or perforation. Use cautiously in patients with rectal bleeding. Let's move on to the side and adverse effects that I can give to those patients who will take me. Yes, I have side and adverse effects that I will give that you can experience and can alter the status of your body. In the central nervous system, the patient will experience dizziness. In the digestive system, the patient will have nausea, vomiting, diarrhea, loss of normal bowel function with excessive use, abdominal cramps especially in severe constipation, malabsorption of nutrients, cathartic colon or syndrome resembling ulcerative colitis radiologically and pathologically with long-term misuse, laxative dependence with long-term or excessive use, and constipation after catharsis. In metabolic, the patient will experience hypokalemia and other electrolyte imbalances with excessive use. Other side and adverse effect is protein-losing enteropathy.
As I discuss the nursing responsibilities, please take note that Castor Oil, and Senna are both laxatives, specifically chemical stimulants, which means we require common things that a nurse should do before, during, and after administering us. Before therapy, these are things that a nurse must do. Assess for bowel elimination pattern to determine the need for therapy. Investigate the patient's nutritional intake, including the fluid intake and ingestion of fiber-containing foods, to evaluate for possible contributing factors related to the need for the drug. Assess the patient's level of activity to determine possible contributing factors for decreased bowel motility. Assess for possible contraindications or cautions like history of allergy to laxatives to prevent hypersensitivity reactions, fecal impaction or intestinal obstruction, which could be exacerbated by increased GI activity, acute abdominal pain, nausea or vomiting, which could represent an underlying medical condition, and even current status of pregnancy or lactation, which could be contraindications or require cautious use. Also, a nurse must perform a physical examination. This is done to establish baseline data before beginning therapy and during therapy to determine the effectiveness of the drug and to evaluate for any adverse effects associated with the drug. Obtain a baseline pulse rate to assess for any cardiovascular effects of the drug. Perform an abdominal examination to establish adequate bowel function, rule out underlying medical conditions, and assess the effectiveness of the drug. And lastly, monitor the results of the laboratory tests, including the serum electrolyte levels, to detect any changes related to altered absorption. During the therapy, administer a laxative only as a temporary measure to prevent the development of a cathartic dependence. Arrange for appropriate dietary measures, exercise, and environmental controls to encourage the return of normal bowel function. Administer the oral form with a full glass of water and caution the patient not to chew tablets to ensure that the laxative reaches the GI tract to allow for therapeutic effects. Encourage fluid intake throughout the day as appropriate to maintain fluid balance and improve GI movement. And if Senna is to be used as a rectal suppository, insert it high into the rectum. Encourage patients to retain an enemas or rectal solution as long as possible to improve the effectiveness. After the therapy, monitor the patient's response to the drug. Monitor for adverse effects. Monitor the bowel functions to evaluate drug effectiveness. If diarrhea or cramping occurs, discontinue the drug to relieve discomfort and prevent serious fluid and electrolyte imbalance. Inspect the skin for rash to monitor for adverse reactions. Provide comfort, support, and safety measures to improve the patient compliance, ensure safety, and help the patient tolerate the effects. Also, monitor the effectiveness of comfort measures and compliance with the regimen. And lastly, evaluate the effectiveness of the teaching plan.